I'm Karen, but the name I answer most to is Mum. I'm mum to 2 teenagers with very different additional needs and disabilities. So, NNPCF, I hear these letters bandied around, and I talk to lots of forums, and some people know what the NNPCF is because they've had an opportunity to meet with my colleagues in the regions, but not everybody gets that chance. And I think that some of the people here today aren't necessarily the people who've got to meet us before. So there are 9 of us, but most important thing is that the national network of parent carer forums is not us, it's you. All 151 forums signed up, whether they realise it or not, they did sign up to become part of the network. Not one forum said, no, we don't want to be part of that. So this is us. This is us collectively. This is parents. And I think, I'm going to look at Sue, but I think there were about 45,000 parents actively involved across the country with forums. That's a huge, huge network, and it's a huge voice. I'd like to start by saying that we are strategic partners. We are the strategic partners to both national and to local government, and we need to see ourselves as that. We're not just parents who are making a lot of noise. We're not just there to influence some of the small things. We're influencing the big things. We are becoming that voice of parents. Many of us started out, the 151 forums, many of us started out within the Aiming High for Disabled Children arena, which we all know has disappeared somewhere, but actually we're the bit that's left. We're still here. We're still influencing those services. And we weren't satisfied, actually, with talking about short breaks. We wanted to talk about all the other things that affect our children's lives: education, health, the wider social care agenda, and all of the things that affect our children's lives. So we had 151 forums, but they were all working with their local authorities and almost became local authority-like, because we were all working in our separate areas, doing great things, but not sharing them. And the idea of the national network was very much to come together and be part of regional networks. That we have 9 regional representatives and 9 regional networks, which some of you are able to come to. And if you don't, and if nobody from your forum goes, then find out about it and get involved. We really, really want to see parents, representing parents at those meetings. And our strength is our shared experience. I think it says it on one of the banners. I'm looking at Sarah because I can't see it, and they're brand new, so I'm hoping and guessing that that's what it says. And that is what this network is about. It is about sharing, it is about being together, and about influencing those agendas together. What does the steering group do? We have a steering group. They're those 9 people that we've talked about that represent the regions. And currently we have one person, Anna, that you met this morning, who is representing a non-regional rep, which is a different brief altogether. But we will have 2 more, and we are actively in the process of re-recruiting new members to represent regions, but also we will be looking for 2 more people to be non-regional representatives. Our main role really has been to provide a focus for forums and for other organisations to get involved and understand the voice of parent carers. We are working very much with that national agenda. We're working with all the delivery partners, who you are going to hear from in a few minutes. We work very closely with DFE. Has David gone? Where's David? David's gone, but David, who you met this morning, we meet regularly with David, and we're able to have a very frank exchange of views, as he says. I can't remember what his phrase was this morning, but he's got the idea. We do definitely know what we're talking about. We have some expertise, and he's more than willing to listen to us. And I think that's something we have to keep reminding ourselves, is people do want to listen to us. They do want to hear what we've got to say. So we also work with the DH. They come regularly to our meetings, as do some of the delivery partners. We've seen them at our meetings, and we've talked to them about parent participation and how best to involve parents. And I know that Kerry is going to talk to us from Mott MacDonald from the Pathfinder support angle. And we've had lots of discussions with Kerry about our brief, which is that being a strategic partner and how it is through forums that the parents' voice can be heard and be strong and be loud. The regional networks that each of my colleagues get involved in are a place for coming together and sharing information. And I had a conversation at lunchtime where one of my colleagues from my own region said, you know, it's really nice to be able to go back to my local authority and say, well, they do that in Suffolk, why can't we do it where I am? Or we do that in somebody else's county. By talking together and working across all the agendas, we actually often as parents have far greater understanding of what's going on in more local authorities and across whole areas, because when it's your job to do a certain part of this agenda, that's your job and you can't possibly take on any more. You have a very in-depth knowledge of some. Parents, I think we kind of have a greater knowledge across far more. Okay. One of the things that the network set itself a task to do, the steering group were very keen that there are all these consultations and things that come out and we don't know what to do with them. And sometimes they're pages long and they're really difficult, and sometimes, no, all the time, they've got a very short time scale. It must be done next week and back to us. So one of the things that we tried to do was set, it needs to keep pushing, was set some priority around some of these consultations, as we know that we ourselves feel a bit flooded, a bit up to here with consultations. So we are trying to set out a way of responding. We've set them out in 4 stages, from the things that kind of impact on us but not a great deal, that we would put on our website and make sure that you have that information. And you can access that yourselves, through to the ones that we think, the green paper, you need to know about this, you need to understand this, and collectively and individually we need to make responses to. That was a very definite number 1. We also took your views at local level, at regional level, and fed that back into the system. And that was hugely successful, because what we heard from the department was that they had more responses than they knew what to do with, and a huge amount of those had come from us, they'd come from parents. And so that has made such a difference in what actually ended up in the green paper, though what we don't know is what's going to be in the next steps document, as and when we might get it. I've stolen this because I think this is something that we are partly aware of. We've heard of this green paper. It is missing its DFE logo, because I don't have technical skills and I couldn't keep that on the same slides. This is very much what the government is currently trying to achieve. Alongside, we've looked this morning at the health outcomes. Now we have the green paper and we have this vision. This is where government is hoping to get to. I'm not reading that, but I have stolen it, because actually I think that's a vision that most of us can buy into. That vision that says we have better outcomes, and we've talked about health outcomes this morning, but we want outcomes across everything for our children, and they're particularly talking about a single plan, a single process. Give parents more confidence by giving them control. Confidence, control do kind of go together. And people like me like to be in control, but sometimes I'm not very confident about it. And it's how we can support people to do that. Transferring power to frontline professionals, and this is real localism in action, and giving parents a real choice of school. And I suppose that's the one I would like to share with you, because I think that that's a huge agenda around a choice of school. And I want to put in people's minds, when thinking about that locally, perhaps what we want is choosable schools. Not more, not different, but we want the schools we've got to be schools that we can choose for our children. Because sometimes they don't feel very choosable. They feel a bit alien, and they don't always seem to have what's the phrase that said? We might not be able to meet your child's needs. We want schools to say and to feel that we can choose them because they can meet our children's needs. Okay, I think I'm going to manage this in time. What I really want to say to finish is, collectively, 45,000 people, we have achieved a huge amount. We have made a big impact. We are getting ourselves involved in so much of the agenda that is out there around our children. And sometimes it feels a bit of a burden. It feels like we cannot cope with one more consultation. It all gets very difficult. But actually, somehow, we have to keep up there. We want this vision. We want to achieve that vision for our children. And somehow we have to keep there. So one of the things is take advantage of any help and support that is offered. In this world, we have managed to get ourselves a reasonable deal. We have a good partner, Contact a Family, and Sue's team are putting together an offer, a really good offer to forums, to help support forums and to help us grow our skills and understand the world that we're operating in. And I know that Sue's going to tell us about that. And one of the other delivery partners that the department has got for us is the early support delivery partner. And I know Kim and Sharon are going to tell us more about that. But I suppose I want to say, for me, that's the beginning of the journey. They have put in place a program that will help us to build our skills and to help us to work with local authorities and service providers from the very beginning. It can be lonely and it can be difficult. It can be lonely when we're doing it for our own children. It can be a bit more difficult when we take that step into the next arena to start talking on behalf of other children and all other children. But I thought I'd just share with you, Philippa, I think, was there at the CDC when we had the health outcomes day. Were you there, Philippa?
No.
No. You were allowed out that day. Okay. I was at that day where the voluntary sector and lots of other people, Shrubney was there, were there. Lots of people who traditionally would have spoken on behalf of our children, particularly those voluntary groups that are disability specific. And they were traditionally the voice of parents. And what struck me this morning was that that group, a fortnight ago, was very hung up on how does that work for this group of children or that group of children, and what about this issue and that issue. I heard none of that from parents this morning. What I heard was children and parents, we all want the same thing. A good service for one child will be a good service for another child. And actually the issues for us all are the same. And I think, again, that's something that we've got to offer, that we think collaboratively, we think together, and we think alike. There are very few occasions when a parent says something that actually isn't something that we all want. There are very few people that do that, and forums have allowed us to find that out about ourselves. And really to finish by saying our strength is our shared experience. Sue's turned me off, so I guess my 15 minutes are up. But really, together, we can achieve even more.